And our next speaker,
drum roll, I have here, Miss Shauna Vaughan from Precision Integrative Medicine.
Hi, everyone. Is this thing on? Am I good? I can't hear myself. Okay. Hi, everyone. My name is Shauna Vaughan. I'm with Precision Integrative Medicine. We're located downtown Clermont. My husband and I own and operate the practice, and I'm coming to you today for your suggestions. First, a little bit about the two of us. I grew up in hospitality management. That was my first career. I eventually decided that I loved training and development, so I got into corporate consulting in corporate America doing learning and development. I have a physiological psychology bachelor's and a master's in instructional systems. I've worked for massive companies, some of the biggest in the world, the Fortune 100 and 500. I've worked for 2 of the 4 big consultancy firms. I've been a public speaker since the age of 9. My mom kicked me out on a stage and said, do that. So that's what I do. I also am a podcast host. Check me out on The Horrible Boss Effect. We talk about how horrible bosses make us better leaders. And I am the boss lady, they call me, at Precision Integrative Medicine. Otherwise, I have this corporate gig where I do consulting and leadership coaching. This is my husband. This is Dr. Dustin Vaughan. He has a bunch of letters after his name, but basically he's a doctor. He has a doctorate in acupuncture and Chinese medicine. So he retired from firefighting after 11 years and decided to go back to med school for integrative medicine. He is an acupuncture physician specializing in integrative sports medicine. There's nothing he hasn't done in life. He had 74 lines of work by the time he was 40. It's true. And there's no injury he hasn't experienced. So he's done everything. He relates to his patients really well. He's been in healthcare for 20 years. He's been in emergency departments, trauma centers like Arnold Palmer and ORMC, and of course in the backs of ambulances and in emergency rooms. This is our why. Over here on the left, this is a photo of us with his maternal grandparents. On the right here is Wayne. He calls him Papa. This is our why. It inspires Dustin because one day he pulled on his cowboy boot, injured his back, and that resulted in his lifespan being shortened as a result because his care was not sufficient. They never addressed the root cause of his injury. On the right there is my Nana. That is my maternal grandmother. She inspires me every day because she's one of those people who was told, there's nothing else we can do for you. That is what drives me. That is my pet peeve in the medical industry. In the center there is Wilbur. That is my husband's paternal grandfather, and he inspires us even still today because he beat cancer using diet and supplementation. So we have deep roots in integrative medicine. Who we are founded in 2021. We have doctorate-level providers. We have 2 doctorate-level providers. That'd be Dr. Enns on the left and my husband, Dr. Vaughan, on the right. Dr. Perry in the center is also an acupuncturist. All these folks are national board certified in what they do. They are specialists in sports medicine, movement, injury, pain, arthritis, you name it. If it hurts when you move it, we can help you with that, with non-pharmaceutical alternatives. We are partnership oriented. We are in this to help you, to walk you through it and be with you through it all the way through it. We are collaborative, always patient first. We do not have competitors, we have collaborators, meaning that if another provider wants to work with us, at the end of the day, we believe that it is all about the patient is the center of our universe. So we will collaborate with anyone and everyone who wants to help patients together. We treat the whole person, we get to the root cause, we care for lasting results, and we are honest and realistic. We are not fast food medicine, we take our time. This is not the place where you're gonna spend an hour and a half waiting to see a provider in 2 minutes, not getting your questions answered. Appointments start at 90 minutes, and usually follow-ups are an hour. We are realistic with you. If we can't help you, we will find someone who can, because we will not tell you there's nothing that can't be done for you, because my Nana was told that. What is sports medicine? It's for everyone, from athletes naturally to active seniors who we love, and everyone in between. So the community loves us. We have been voted the best of in several categories in several different contests, and so we love that and we're grateful for it. Our goal for our patients is essentially improve quality of life. We want them to thrive and then ultimately become raving fans. We have a bad business model. Yes, we want to fix people, send them on their way, and have everyone tell everyone about us. And yeah, and they come back when they re-injure themselves. Our current challenge, let's get to the nuts and bolts of it. My husband, Dr. Vaughan, has been diagnosed with a recurrence of cancer. As a firefighter, it is a risk of the job. And so here we are 5 months into this journey. Naturally, he will have to take some medical leave. We don't know when or for how long yet, but we are anticipating this is going to be presenting a problem for us. Our rent is rising, overhead continues to increase. I'll be honest with you and tell you that we are aware that our rent is going up just about 50% in February, so it's massive, yes. And we've only done one price increase in 5 years because we are higher priced in the area. Perceived barriers, when people call us, they believe that all acupuncture is the same, meaning our acupuncture practice is the same as the one down the road, and in fact, it is not. We're all different. We don't accept insurance, that's a non-negotiable. And so there's a misperception there that because we don't accept insurance, we're not affordable, but we like to stay away from insurance because it keeps us away from having to be fast food medicine. My ask today is that I need help with a sustainability plan. What strategies would you recommend to help us grow and sustain the business? And with that, I'll pass it to you.
Thank you so much, Shauna Vaughan, everyone.
So you're looking for a sustainable plan. That's what you're looking for.
Yeah, how do we survive the absence of my husband, the face of the business?
I have two comments. One might be helpful now, and one might be helpful for everyone else in the crowd. If you can afford to, I want to submit your consideration to consider buying a building. And that was the only building you can control the rent cost and you have tenants in the building if you have to move out. And if you go back in a year or two, and you're not going to call out covers to move back in. And or you already have two other physicians working with you, perhaps create another physician, maybe to have a third physician to replace your husband and see these patients. That will come with some expense, it's not just the same likelihood, but at least the practice will stay open. So those two things I thought would help you stay open.
Absolutely. We don't have capital to purchase a building. I would love to do that.
There's a solution.
But we're also not profitable. I didn't mention that. We are break even after 5 years, so we're doing great sustaining ourselves, but we are not profitable.
There's a loan program called DSCR. It's not credit rated. All you have to do is have an EIN business, and you can use that product to buy and or renovate a property. DSCR.
Okay. Thank you.
That might be helpful.
Mhm. I'm familiar.
SBA. The last thing I wanted to say that might help others is insurance that people should buy before they buy premise on the situation. Business ownership policies that if you become sick, you're able to kind of leverage and keep your business.
We looked into that. He doesn't qualify because of previous cancer. I hear you. Mm-hmm.
Can you go back here?
All right, good morning. I'm Jim Gray from the Untitled Chapter of 1Million. I have two thoughts. One for everybody. If you present here, present there. You're going to get two different opinions from the North and South Lake County. Now, my thought for you is, with the rising rent costs, would it make sense to eliminate the brick and mortar and go with a mobile service? Because you could really trick out a mobile truck and probably at the cost of half or a third of where your rent costs are going to go, and then just schedule accordingly based on location. You're going to be in this area one day, this area in the next day. Maybe just a thought to offset that rising rent cost.
Thank you.
Let's go here to Nate.
You're up.
Go ahead, Lee, and then we'll go to Nate.
I just want to concur what he said, because capital, I mean, it is great to be able to own the building, but if you can just actually do like Monday, Wednesday, Friday, or do a mobile, that would cut down a great cost for you. And again, connect with community and introduce people to get to your mobile. That's one way to cut costs.
Okay, go back here to Nathan.
It's hard to know without seeing the financials, obviously, but if you are in a position where you're break even, there's typically two things. One, your revenue stream is not profitable itself based on your variable versus your fixed costs, or if you have the capacity, you already have those fixed costs that are ahead, which are building with bring fixed costs. You know, looking at the capacity, then your marketing would be the issue. Obviously, I don't know which one that is, but that's typically the place that you need to look at, is whether you are profitable as a revenue stream, or if you have the capacity and the revenue stream is profitable, that your marketing is not currently being utilized properly.
What I can say is I have, and I don't know if this is helpful, but when I share with the South Lake area what our price point is, for example, I get a little bit of friction that it's maybe too high. When I go to the east, naturally into Oakland, Winter Garden, and further, it's like, oh, that's super reasonable. So there is that bit of things where I feel like if we raise our prices, we're going to push an entire demographic out that we absolutely love. We chose Clermont for good reason, but yeah, I don't think marketing is the problem, but I will talk to Jackie. But yeah.
Hey, Shauna, great presentation. You're not the only one with this problem. I have been hearing it from a lot of local business owners. Some of the strategies that we're implementing as well is, and I don't know if it's something that you can do if it's a lease situation, we're partnering and collaborating with business owners that are aligned with our mission and vision, and allowing them to use our space for their product, service, to deliver it using that space, and almost like a revenue share, which will help us offset some of the costs that we have in control. And I have suggested that to others. It might be something, again, I don't know how restricted you are with your lease, but you have an amazing property that is highly valuable. You have the space, right? If it's possible, perhaps it could be a revenue stream
Okay.
that you might help you in this situation.
Okay. Thank you.
Great presentation, and
Thank you.
what you do is fantastic. The thing that is important is understand the market, right? You are in out-of-pocket market, which is a very challenging one. So you really need to understand if there is enough clients for that business model to work. I mean, you can be a great business owner, but if the business model is not good enough, you won't make money, right? So you first need to understand if it's a viable business for you to invest your time and money. If there are enough customers for you, even going to the mobile services, is it enough for you to do that investment? If there is enough market, then what is the best model to attack it? So how do you invest your expenses? I mean, like Megan said, what is the best approach to make money, to make a profitable business? So I think we have a lot of resources for you to understand, how can we size that market? That would be my first question,
Okay.
And I know many other practices that go through that market and they do kind of subscription model. Do you have a subscription model?
Yes, when we raised our prices the only time in 5 years, we did offset it with memberships and packages. We didn't see much of we do have that as a recurring income stream, so it has worked to an extent, but not like we expected.
Yeah, so that would be my first question is understand the size of that market, who else is there, and if you reach X amount of market share, is it profitable enough to be still in that market?
Yeah, absolutely. We actually came into the business, we came to Clermont knowing that it's a mecca for athleticism and athletes, expecting that athletes would be our primary, most common patients, and in fact, they are not. It's active seniors and beyond. Octogenarians love us because we can help their knees, but yeah. Nice perk, yes.
Hi, good morning, Shauna. Jared Taylor, Sugarloaf Partners. I first and foremost wanted to say I'm so sorry to hear about your husband's recurrence cancer, and I'll pray for you and your family for healing.
Thank you.
In this country, medical bankruptcies are the #1 cause of bankruptcies here in the U.S. You have a lot of change going on in your life. I think something that you should do is remember the concept of the sunk cost fallacy. If you take off the names, the dates, everything, and you just put John Smith, Jane Smith, what would you do for them?
That's fair.
And I know it's a tough and sort of emotional thing to do, but you and your husband and your family, you have to focus on his care. The business will exist, there will be a market, whether you do it now, but take your names off of it and think about what's the best for you and your family.
Thank you, appreciate that.
Yeah, I'm just curious about what kind of payment methods are you offering for people? Because I know that, for instance, if I go to the dentist and things like that, a lot of them have. If somebody doesn't have insurance, a lot of times they need to pay through some other means that they can spread out the payments. Are you guys having any challenges with people, I guess, succeeding in those? Are they taking those payment plans, like paying for, Klarna, are there medical plans?
So I have struggled with the concept of putting people on payment plans and having them finance their health care because I don't want to add to the burden of debt for people. So, which is why I have really pushed back not wanting to raise prices, because I do want to keep it accessible to people so that they don't have to finance it. We might be getting to a point where I'm going to have to just get over that. But that has been our whole conversation about financing it and putting in payment plans and price. As far as the memberships, is that what you were asking? Yeah.
The reason that I asked specifically about paying fours, I don't know what your price point is, but paying fours are far, far more successful than someone who's doing something like a 12-month plan or a 24-month financing plan. If you look at the data with paying fours, it's, I'd say, a very, very high number that people pay that bill, and it doesn't put them into a, they're not trying to long-term finance. It's something like, hey, maybe I need to pay for this and I'll pay for it over my next couple paychecks, but it's still accessible, but you're not putting them into a financial burden, because I totally understand.
Yeah, I don't want to do that.
Financial burden, but with those payment plans, if you look at the data, they do really, really well, and for the most part, people don't get stuck in those.
Yeah. Price point to get established at our practice is anywhere between $135 to $175 between what provider you see. Acupuncture follow-ups are $90, osteopathy follow-ups are $165, injections run $25 to $60.
Hey John,
Hi.
I'm Dr. Tyler, Restart Physical Therapy. In terms of sustainability, in terms of finding someone else to replace Dr. Vaughan, we can either hire someone that's really an expert in their field who already has the credentials for it, or I would recommend a student. You can do two things: train them, especially when they're out of school. You can train them the right way, because Dustin knows a lot, so he can teach them the way he would treat them, break it down, completely mold them, because they're clay, right? Also, when you have a student there, lower your prices for that student also, and then so that they can attract their own patients, and then that kind of helps them gain that experience without having that premium price where it's like, oh, I'm seeing a student, is that going to be good or not? So bring the price down to get that more attractive. So that's
Thank you.
something to think about in the future.
Appreciate that. We did try in the past getting a student. We'll talk. Yes.
Two things, Shauna. How quickly can you get out of your lease?
It's up in February, and it's easy.
How sustainable or apt is it for you to go to a mobile contact?
Requires capital investment that we don't have.
One quick question: have you looked into ways to minimize some of the expenses that some of the costs without compromising quality?
Absolutely. I did hire a business strategist for that purpose, and he tells me that we are a lean machine. So as far as expenses, we do really well. Yeah.
First of all, I want to thank you for being vulnerable and sharing. Like I mentioned to you before, just hearing this question and listening to you about a sustainability plan, it really, if we hadn't thought about it as entrepreneurs, it really should give you pause in terms of, have you thought about how does your business exist if you are removed from it? And so it really made me think and pause about what does that actually look like. And so one of the things that I would say is you have another board certified doctorate level position there, and how could you market and tell the story of that leader so maybe we can attach that love for Dr. Vaughan over to this is the person who's going to be supporting the business, and really, just like you showed vulnerability today, telling that story within the community so that the community can uplift this business in his time of need.
Thank you. I've tried to shelter the community. Maybe that's a bad approach, but I don't want people worrying. So yeah.
Do you know how many customers it requires you on a monthly basis to meet the break-even one, but also to make the profit margin that you actually need in your current revenue stream?
I don't have those numbers off of the top of my head, but we can talk if you'd like.
Any more questions? Any more hands?
Any more feedback? Anybody in the community that's found themselves in this similar situation, perhaps, that is working their way out of it? I think our asks today are somewhat similar, and honestly, from a business perspective, it's not an uncommon thing for not just Lake County, but outside of Lake County. If you're new to the area or you're trying to do something different to reach that community, what makes your community tick? And that's where all this feedback from each of you, not only business owners, but community members as well. How do we do business in Lake County? You say Winter Garden, Winter Park, they go, oh, that's inexpensive compared to, well, that's how we do things out here in the Wild West, right? It's not an uncommon thing. So as you guys are carrying on through your professional days or driving on Highway 50 and you find yourself with some extra windshield time, maybe think about a time when you found yourself in your new start in this, and what was something that you tried. Talk about radically inclusive, maybe we give it a whirl. I think that's one of my favorite things about Lake County is that we do things a little differently than Orange County does, but what is that? So if there's something that you guys as business owners, again, or community members can come up with even after this, that you think about, that's how we do things in Lake County, or I saw this and it was unconventional. But I think tying in, yes, there's a need for business, but I loved what Doris said about uplifting this small business as a part of the community, whether it be in their time of need or their time of desire to flourish. And that's what 1 Million Cups is all about. So yes, the vulnerability that both of you showed today, thank you so much for that. And I hope that you as a community feel the responsibility to do exactly that, uplift these businesses and support them however that might look, whether it's an idea, if it's patronizing them as a patient and getting some relief for something that's been bothering you, sharing with a family member. I think that's what 1 Million Cups is all about, and that's that community aspect that we're looking for. So your suggestions and feedback don't have to stop today. If you have more, here's that QR code and reach out to her. We do have time for a few more questions and some feedback, so if you guys think of a few more things, please feel free.
Is that something in your industry that you can do, or you can find somebody with that same business that you can do that where you share a space with them? Yeah, we've looked into time sharing space. It is an option, yes. And the gyms, yes. Thank you. Mm-hmm.
So Shauna, what is your timeline?
What is the
February?
timeline?
The plan.
Well, it's hard to say because I don't know what Dustin's timeline is for his next steps. But our lease is up in February. That's when it will increase, as I mentioned. And then, you know, we just kind of need to be planning, I would say, for the next month or so about what's going to happen with his care plan.
Okay. Yep. Look into other buildings that might be less expensive, or partnering with other similar businesses that have really large spaces that are really too big for themselves.
We have renting space. The cost of commercial rent, I don't know if you all are familiar, is absolutely asinine right now. That near 50% increase that I mentioned is how the market in Clermont has changed in just the 3 years since we started our lease. It's insane. As far as renting space in other buildings, we have explored those options. We just haven't found the right fit because we still want to find someone who has some like synergy with us and we share the same kind of clientele where we can cross-refer and it be really synergistic. That would be most ideal. So yeah, thank you.
Well, thank you, Shauna. Thank you so much. Appreciate it. Shauna Vaughan, everyone.
Thank you, Shauna. There's Shauna's contact information again. If there's anything that you think of, I'm sure she will take your call or your email.